I'm joined by Dr. Casey Harbine for another edition of Morning Rounds. Thanks for joining us this morning.
Yeah, you bet.
All right, today's topic, hepatitis C. So first question, what is hepatitis C?
So hepatitis C is it's a blood-borne infection, meaning it travels in the blood. It's a virus, and it causes inflammation in the liver. The designation C is just to differentiate it from other types of hepatitis viruses like A and B. And it's unlike other hepatitis C actually can lead to chronic infections, so chronic liver inflammation in about 75 to 80% of people. So it really becomes not just an acute infection that goes away, but something that people have to live with for a long time and can actually cause a lot of problems.
So what are some of the risk factors of hepatitis C?
So IV drug use is a big risk factor. It's blood-borne, so anything, that can travel from one person to the next through the blood. Blood transfusion or an organ transplant prior to 1992, when they really started testing blood products for hepatitis C, is a big risk factor. Exposure to the virus in a healthcare setting, unlike HIV, which is not a very stable virus, it dies very quickly. Hepatitis C can actually survive in dried blood for a little while, so really being careful about your exposure to that. It's not commonly transmitted via sexual intercourse, however, unlike other blood-borne infections.
So what are some of the symptoms?
So initial infection would just maybe be like a general viral infection. Sometimes people turn yellow because it's infecting the liver, but I'd say most of the time people were never aware that they were ever infected. Over time, most people don't even know unless they get some blood tests and see that there's a little bit of inflammation in the liver. And so typically, if there are any symptoms, it's really in advanced stages of liver failure.
Are there any recommendations for getting screened?
Yeah, it actually seems to have a much higher prevalence in people of the baby boomer generation and in Vietnam veterans. So it is recommended that people who were born between 1945 and 1965 have checked at least once. The screening test is an antibody test, and if there are some false positive tests, so there are secondary tests that can be run if that does come back positive.
Is there any prevention or treatment for hepatitis C?
Well, there isn't a vaccine. They're working on that. Obviously, preventing this infection would be the best thing because it can really wreak havoc both on the body and on the healthcare system. Right. It's a big deal. Until the last few years, treatment was really poor. The treatment would take a long time, and often the treatment made people sicker than actually just having the chronic infection in and of itself, and wasn't very effective. But in the last few years, there are some very effective treatments that really can cure people of hepatitis C in 8 to 12 weeks, but they are very expensive, running about $100,000 for the total treatment.
All right, well, thank you for answering some of those questions for us this morning on Morning Rounds. If you have any questions that you'd like answered, you can email them to us, morningrounds@kpax.com.